find my page here. Mr. Speaker, I rise today to share with you and the House of Representatives stories of real people from Colorado who shared with me their experiences with health care and why it's so urgent for Congress to pass comprehensive health care reform. One of my constituents, Jane Marshall from Lafayette, shared a very compelling story with me that I want to share with you to help show what many American families are going through. The story that Jane shares is an exasperating story, and she's normally reticent to pass this kind of story along, but she knows that there's the hope of a happy ending because of a health care plan and her family's contribution in helping that occur by sharing this story. Jane and her husband have 5 children, ages 20, 18, 15, 12, and 8. And their health care has always been determined by her husband's employer. The company that her husband worked for has changed insurance companies from HMOs to PPOs to HSAs to whatever policy or company was fiscally appealing to them at that time, with no regard to continuity, allowing family to keep their doctor, or anything else. This meant that none of their 5 children ever established a relationship with a pediatrician that they would even grow to know and trust. No sooner would they get to know one pediatrician than it would be switched as the company switched their health care reform. They'd start to become familiar with an office, and then the insurance changed again, and the process would start all over again. The list and amount of paper that Jane had to go through would appall all of us. Then, 2 women in Jane's husband's office were diagnosed with cancer within a 2-year period. Their family insurance rates skyrocketed because of the small risk pool of the business. They researched the escalated rates to determine the reason behind the increase. Because 2 people in the group plan were now considered high risk, the whole plan had to cost a lot more. They weren't even notified of that by the employer or the insurance company until they got the bills. Then they, like a lot of families, had to find it necessary to insure themselves and their children out of pocket because the cost of insurance through Jane's husband's company became unaffordable. They acquired an insurance plan with Kaiser, but the only plan they could afford was a very basic one with large deductibles, and those deductibles loom like heavy weights on the family as they worry about what would happen if any of them ever need to be hospitalized or require emergency care. Additionally, during the transition from her husband's insurance to Kaiser, their son was denied coverage because of a diagnosis that he had. One of the things that we accomplished in this bill is we create low-cost exchanges to provide competition among insurance companies. People who are uninsured, small businesses, can be part of one large risk pool and acquire insurance in a competitive environment, high quality at a low rate. We also ban pricing discrimination and exclusions based on pre-existing conditions. Jane's husband recently lost his job, as many Americans have during this recession. They're hanging on, waiting for the economy to turn around, waiting for him to find employment and hopefully to find insurance coverage. In the meantime, they're paying out of pocket more than they can afford for insurance. Their situation caused them to evaluate their finances from a survival perspective and make any and all cuts that they had to keep paying those premiums. Jane shared that insurance itself is not far from the chopping block of what they might need to cut to get by, put food on the table, and continue to live their lives. While Jane feels that the waters before her are murky, she has hope that this Congress will act and pass comprehensive health care reform so that families like Jane's across this country have access to a low-cost option, receive affordability credits to help afford health care, and drive down the cost of care, and ensure that kids growing up can see the same pediatrician for 10, 20 years as they're growing up and build those relationships. And that's why, for the sake of Jane Marshall and millions of Americans like her, we need to pass comprehensive health care reform. Thank you, Mr. Speaker.